it's funny. I don't even care anymore. Like in the beginning of this, I was like, what should I wear? And whatever. Now it's like, it doesn't matter.
Yeah. Everybody's living in sweatpants these days.
And nobody cares, which is great. Like nobody's like, I don't believe that guy went on his Zoom video wearing a sweatshirt. Like nobody cares.
I know.
Which is good because Tyler hasn't showered in a couple. I'm kidding.
What the hat's for.
So we have Rick here from AblePay. And I'm not going to do a disservice to the company by explaining what it is. So Rick, if you could, I have used it before. So, I mean, I know what it does, but I can't.
George is the only person that you can pay for an endorsement, but you pay him to not talk.
Yeah.
They did. And they didn't even pay us. Like I'm horrible.
Yeah.
So Rick, if you could kind of describe what AblePay is and what maybe you've been doing for the last 2 weeks or so, I'll let you kind of take it.
Okay. Well, AblePay is a voluntary, no-cost benefit that allows healthcare consumers save money on their out-of-pocket medical expenses, their deductibles and co-insurance. So currently, we have agreements with our participating providers. So locally here in the Lehigh Valley, both St. Luke's and Lehigh Valley Health Network are participating. That's the entire network. That means all the hospitals and all the owned physician groups. In addition, we have Penn Medicine and Mainline Health System down in Philly, Lancaster General in Lancaster County, Grandview Health just came on board a few weeks back in Upper Bucks in Montgomery County. So our members are able to go in and save potentially up to 13% on those out-of-pocket medical bills that everybody's struggling with. And right now, with all the focus on healthcare and the unknowns, so it was bad enough when you had these big deductibles and, trying to figure out how you're going to pay those bills, let alone, with all the COVID-19 and everybody a little worried about potential bills if they would get sick, etc. But the way it works, again, it's no cost. We get a discount from the provider. In exchange, we guarantee them payment in 2 weeks. Right now, medical providers are struggling to get paid as these higher deductible plans have come into place. Patients struggle for one reason or other to pay those bills. And we kind of bridge that gap between providers and the patients.
My experience was, nothing crazy. I went to a foot doctor and it was like, I don't know, $400, right? So I use AblePay, and then you're able to kind of break it out into a couple months, right?
If you decide, right.
Yeah, that's what I did. I mean, I'm just like, I'll pay this over the course of 3 months. And then AblePay just kind of took care of it for me. I mean, they didn't pay for it, of course, but I got a discount, and then I was able to pay over a couple months instead. So right. It is helpful. Maybe it's not for everybody, but in that situation, it was really good for me, and maybe it is.
So is this something that people should come to you before they seek medical attention, or is this after the bills start coming in, then they could talk to you?
They should have enrolled prior to seeking medical treatment. It makes it easier. There are some providers that will allow us to go back. There are some that you have to be a member going forward. So the sooner you enroll, the sooner you'll be able to take advantage of the benefits, and we can guarantee those discounts at the provider. The enrollment is easy. You can go to our website, ablepayhealth.com. Literally take 5 minutes or less. It works with any primary health insurance, even Medicare. So as long as you have a primary in place, it doesn't matter. So if you have 2 different insurances in the family, spouses work at different employers, and they each have different benefits, it doesn't matter. They can all go in the same AblePay account.
What about if somebody is paying on their own? Can they use your service too if they're going to pay out of pocket?
Sure. They have that flexibility.
An uninsured person?
Right. So, no, there has to be some sort of primary in place, because the way it works, once you're enrolled, you'll get an AblePay card. It's very much like an insurance card. We encourage our members to keep it with their primary insurance card. When you go to the doctor, you go to the hospital, you show your primary and you show AblePay. AblePay gets entered as a secondary payer. Even though we're not insurance, we go in that secondary bucket. And then the bill goes out to the primary first. They're going to adjudicate the bill. Our members still get their explanation of benefits. That doesn't change. The only difference is, instead of getting the bill in the mail for what you owe, It comes to us electronically. We send you an email. Tyler, you have a new bill. Go to your member portal. Tell us how you want to handle it. At that point, you can decide what makes the most sense for you financially. So when you enroll, you're going to select a payment term, 1, 3, 6, or 12, and then you're going to enter payment methods. And you can link any payment method or methods that you're comfortable with. So anything ACH driven, checking, savings, health savings account, as long as you have an account and a routing number, goes in as ACH. Anything on a card, credit, debit, flexible spending accounts go in as a card. And the only difference, there's a 3% difference in the discount if you use a card just for the transaction fee that we get charged. So let's assume today a bill shows up in your home for $500. You're trying to figure out how you're going to pay $500.
Right.
As a member of AblePay, say you have your checking account linked and you have the ability to pay in one payment, we would pull $435 from your checking account. That bill is satisfied, it's paid in full, you just save $65. But if you didn't have the $435, we give you the flexibility to spread it out over payments. You could pay that bill over 3 payments, still save 10%, 6 payments, save 8%. We even help our members spread those bills out over 12 payments. At 12, we don't give you a discount, but we don't charge you any interest. So we're a free financing vehicle for you at that point.
Okay.
Yeah,
well,
and,
I mean,
and
obviously
Tyler,
for me, I'd be most comfortable having George's credit card as my payment.
And you can do that. If you want George to pay your bills, you can have George add you to his AblePay account, and that will work.
I'd love if George.
I was going to give Tyler a Lehigh Valley with Love credit card. Now I'm not so sure.
Yeah. Unlimited limit.
And normally I wouldn't say, hey, come on and let's do basically a commercial for AblePay, which is fine because AblePay is a local company. And that's why, I thought it was totally fine. You are local, correct? I mean,
right. Yeah, our office is in Bethlehem. We're right in the corner of Main and Broad Street. So we're just across the street from the Bethlehem Brew Works. We started here in the Lehigh Valley and, we're continuing to add providers and grow, but St. Luke's was the first provider on board, May of 17. And then Lehigh Valley came on as well as Mainline, July of 18. Penn Medicine came on just the end of 2019. As I mentioned, Grandview Health just came on a few weeks ago. So we're continuing to add providers in Pennsylvania and looking to expand outside.
What are some things that, if somebody's listening that's a little anxious right now about the current situation, what are some questions that you're getting, some frequently asked questions that maybe you can help alleviate some anxiety through this whole process, whether it's through AblePay or for insurance at all? Like, I don't know what your background is. It's got to be in some kind of, this is your company, right?
No, it's not my company, but I'm Vice President of Marketing and Communications. Yeah. I do have some experience in healthcare. I spent a number of years. My background is primarily marketing and advertising, but I have spent a lot of time in healthcare. But the biggest question that we're getting right now is people worried about these outstanding bills, if they do get sick, and also, with the situation with a lot of people being displaced and being out of work. And, I have COBRA now. What does that mean? I have to pay more out of pocket. Will it still work with AblePay? And how can AblePay save me money? We've worked primarily with health insurance brokers and employers to offer AblePay as a no-cost benefit to the workforce, but we really haven't engaged the community at large. And I think that's the biggest question we're getting now. People are telling their friends and neighbors, because it is such a unique program, there really isn't anything in the United States that we have found that a company doing what we're doing at AblePay. And, we've literally saved some families anywhere between $100 to $1,000, depending on how much their out-of-pocket medical expenses are. We've recently been looking at a lot of those numbers and sharing some of those statistics with our HR partners and employer partners. So right now, we're really just trying to get the word out how we can help the community at large. Anybody is eligible to become a member of AblePay. They don't have to come in through an employer, but we really haven't engaged that market yet. So right now we're doing webinars beginning at 2:00 this afternoon, every day at 2:00. from now through April 10th. We're going to do a webinar for anybody in the community that is interested in learning more, how it works. We'll walk them through the demos, show them how easy it is to enroll. We'll show them how they would pay their bills through their portal. And they can go right to our Facebook page. There's an event created for that. And again, anybody's eligible to enroll and take advantage of it.
You're probably gonna have to extend that to April 30th now after the news. The one thing that I did like, and I don't want to speak for Rick, but I know that there are times when you are dealing with health insurance, especially hospitals or whomever, and it can be difficult to be on the phone or to kind of, I don't know, represent yourself. So I know that AblePay, I don't want to say anything, but I know that you do have people who can kind of help someone talk to the hospital or,
Correct.
Help you with your bill.
That's correct. So, we say we have 4 major benefits: discounts, flexibility, and convenience. And those 3 kind of work together as far as how you pay your bills through AblePay. I already talked about the discount and the flexible payment options. The convenience comes in with the member portal. And George has seen it. It's very intuitive. It's very simple to use. There's drop downs on there. There's a window that you can go and view your claim, etc. But the 4th benefit that we offer is an advocacy for our members. And anytime a member has a question on a bill, a problem on a bill, or a question in general, we're there to help them. Statistically, across the country, over 30% of every medical bill that gets sent out has some sort of mistake. So, you can figure as a patient, every time a bill hits your mailbox, you have a 1 out of 4 chance that it's going to be correct. And, so that being said, our operations people, they have over 30 years of medical billing experience. So as claims are coming into our office, someone in our operations department is already looking at them. We're looking at CPT codes against charges. Why is that knee x-ray $10,000? That doesn't make sense. But if a member ever has a question or an issue, all they have to do is pick up the phone, call us. Between 7:30 and 5:30, a live person is actually going to pick up the phone and speak with somebody. You're not going to get put into a phone tree. Mm-hmm. We have a support email. So even on a weekend, if somebody sends an email out, one of us will see it and we'll say we'll take care of it. So we talk to members on Saturday evenings, Sunday mornings, whatever works for them. We're there to be their support.
Yeah, you're a member of the community, and that's kind of something that doesn't happen if you call your big time healthcare provider, right?
Right, and that's why I wanted him to come on, because it is something that I feel like if there are individuals who take advantage of it, it can really help them because they can get some advocacy on their behalf. And that's
I would be interested to know how many in those billing errors, how many benefit the person that gets billed. How many times?
Very little, if any.
Okay.
Yeah.
So.
It typically goes the other way. And,
right.
And
wonder why.
We've engaged. We're over have over 20,000 members right now. We've been working at AblePay for about 3 years, actively selling, just coming up on 3 years. And we've done a lot of meetings. We've spoken to a lot of people. A lot of people are taking advantage of it, but there's so many more that can take advantage of it. But, we usually, talk about the discounts and we talk about the flexible payment options, and people love that. In fact, we just did a survey for our members. And when a member enrolls, we ask them 3 questions as it relates to their current billing experience. And we ask those same 3 questions to see how that experience has changed since they've used AblePay. And we've increased those percentages by 50 and 60%. So we're actually increasing the patient experience overall. So we're not only saving them money, but we're making the whole experience that much easier.
Well, yeah, anything that could make, going to the hospital or getting medical treatment less stressful and, easier at the end of the day is a no-brainer, and we appreciate anything you could do to make that happen. So, thanks for coming on and sharing. This is pretty cool stuff.
No, we appreciate. No, I was saying we appreciate it, and like I said, normally I wouldn't say, hey, let's do a video about this, but I think that it's very important, and you guys are providing a service that can really help people.
It's just it's an option, right?
It's an option to die. And that's why I wanted to have Rick on, because I know there are people out there who could definitely in our community use this, and that's it.
Yeah, and I appreciate you guys having me on. You know, the biggest thing we encounter, because it really doesn't cost anybody anything. And George, you know, you haven't paid a dime for it.
No, it saved me money. That's all. That's all I did. I signed up, and it took money off of my bill. Thank you.
No, and you're welcome. And we appreciate you being a member, and we appreciate you having me on to be able to tell everybody. Hopefully this will drive some people to attend one of those webinars. You know, we all have a lot of free time right now. And at 2:00 every day. So go to our Facebook page and join one of the webinars at your convenience, and learn how it can save yourself and your family a great deal of money, and how we can be there to support you if you need it.
Cool. Sounds great. I don't think we'll get this up before 2:00 today, but definitely before 2:00 tomorrow. So we'll make sure to link in there and get that going. So Rick, thank you so much. Thanks for having AblePay help people out, and I hope to see you soon. You're right downtown. Walk by your office like 500 times a week. So
I know. One of these days we'll all be back at it, and maybe by Music Fest time. Who knows?
That'd be great.
I hope so.
Right.
Hey, Rick, be safe. Thanks for calling, and we'll talk to you soon.
All right, George. Thanks. Thanks, Tyler. Take care. Bye-bye.
Good.